I am going to get us started. Just to introduce myself real quick, my name is Joanne Harris Duff. I am the program manager for diversity, equity, inclusion. And if you join us later as you're watching this as a recording, thank you for tuning in and participating in one of our programs. So today, April, we're celebrating Diversity Month. So Celebrate Diversity Month started in 2004, and it was created to honor and recognize the diversity that surrounds us in all aspects of our lives. It acknowledges differences of race, gender, sexual orientation, language, family dynamic, socioeconomic status, ethnicity, nationality, abilities, and so much more. Everything that we celebrate here at VCU Health and VCU, by understanding that we are all different and that we each bring incredible talents, abilities, and skills to our shared world, we can gain a deeper understanding of one another. This not only will make VCU Health System and VCU a better place, but it can also have a long-lasting impact on our patients, our team members, our families, and our community. So celebrating Diversity Month, we're going to boost cultural awareness. We hope we do that all year round. And I would really enjoy I would encourage all of you to please learn more about National Celebrate Diversity Month. So before we get started and I introduce panelists, I also want to share that in April, we also celebrate other celebrations and awarenesses, and we recognize many different cultures. And I have a list, but this is not an exhaustive list. So April is also Arab American Heritage Month, Autism Awareness Month, Black Maternal Health, Earth Month, National Volunteer Month, National Child Abuse Prevention Month. And I like to make sure I mention those because there are certain aspects that touch all of us in our lives. So please, again, learn more about those. Okay, so we are going to ask some fun questions today from our panelists. I first want to introduce all of them, and I invite you all to share a little bit about yourself after I introduce you. First, Allison Scott, Continuing Education Coordinator. Allison, would you like to share a little bit about yourself?
Hi, Joanne. Thanks so much for hosting this panel today. It's exciting to be a part of this group. As Joanne said, my name is Allison. I have been on the continuing education team for almost 3 years now, and I'm very passionate about seeing connections between people and allowing people to grow and develop as an educator and making those connections in my role at VCU. So thanks for having me today.
Thank you, Allison. I would like to introduce Cheryl Winfield. Cheryl is a patient transportation supervisor. Cheryl?
Hi, my name is Cheryl. I've been in patient transportation for about 5 years now. Nothing too special about me. I am Korean. I do speak fluently in Korean, and to piggyback off of Allison, I love to make new friends and kind of like build rapport with people, and just me, just friendly old me. Nothing too special, no pizzazz.
Thank you, Cheryl, and I'm sure there's a lot of special. I'd like to introduce Dan Milby, Patient Access Senior Representative. Dan?
Hello, everybody. My spouse and I moved to Virginia in October of '98, both born and raised in Florida. We owned a barbecue restaurant in the mountain for 15 years and moved to Richmond 4 years ago. Tomorrow is my 3-year anniversary with VCU. Started out as an administrative assistant, and I'm now a new patient coordinator in the Massey Cancer Center. And I'm happy to be here.
Thank you, Dan. I'd like to introduce Roy Roach, Director of Student Experience, VCU Health Sciences.
Good afternoon, everyone. I appreciate you, Joanne, for the invite. Cheryl, I'm pretty sure we're going to find out some fun stuff about you. So we're going to let the conversation continue. But again, it's a pleasure to be here. I've been on this side of campus a little bit over a year now. And so I'm really excited about this. Probably something fun is I used to be in the military, lived in Japan. So like you, Cheryl, I love languages. I love to speak different languages, study Mandarin as something random. And so I did that for 3 years. And so I'm really excited about helping our students reach the potential of being able to serve patients. And so I'm ready to get started. I'm sorry.
Thank you so much, Roy. And I am excited to also introduce Dr. Michelle Cosby, Assistant Professor of Psychiatry.
Well, thank you, Joanne, for the invite. I am excited to be here. I love talking about this topic all day, every day, whenever I have a chance to. So I am a clinical psychologist, primarily here at the Virginia Treatment Center for Children. I've been here, I want to say going on 3 years now, but have been kind of throughout the mental health system in Virginia. Born and raised Virginia native, VCU is central to all that I know, even when I was little and was driving past the signs. And so just excited to talk about it. I think one of my other hats is kind of psychology training director. And so very important for me as a clinician of color to help mentor and kind of help additional folks come along the way. And kind of just mentor the next generation of clinicians to keep all these topics in mind as they're working with patients and families.
Thank you, Dr. Cosby. I appreciate that very much so. All right, so how about we get started with some questions? And like I said, some of them are going to be fun. Well, I think all of them are fun. And it'll give us the chance to learn a little bit about you all. So we'll start with Allison, since she started introducing herself. So Allison, tell us about yourself. As you've already shared a little bit about yourself, but can you share with us why working at VCU Health is important to you?
Absolutely. I came to VCU Health with kind of a combined background in healthcare and in education. And so getting to work on the continuing education team has been a real pleasure for me in terms of kind of combining those passions. I love to see people grow and develop. I love to plan things. I enjoy designing curriculum. Those are all things that are part of my passions. But personally, I also come to this work from my own experience as a patient. I was born with a rare form of skeletal dysplasia that causes me to affects my joints in a lot of different ways. And I am a little person. And so coming to this work, having had that background of having gone through a lot of different orthopedic procedures when I was younger and dealing with ongoing orthopedic care needs and then just being different from average people in that I am small and I use an electric scooter for mobility, I think has brought an added perspective to my work at VCU, where I have really enjoyed getting to advocate for patient-centered care and including patient voices in the conferences for continuing education that our team runs. And I think that having had personal experience to bring to that ignites my passion, as well as helps me to really think through more intentionally how we do that well across the health system. So that's something that I come to this work with.
Thank you, Allison. I appreciate that.
Yeah.
And Cheryl, how about you? Can you share with us maybe a little bit more about yourself and why working at VCU Health is important to you?
Sure. First of all, I want to apologize for keep going off and off the screen. I'm the only leadership here today, so they're not noticing the sign on the door. But yes, I honestly originally came to VCU for benefits. And as the days and the years went by, I built such great rapport with team members and patients. And most of all, the best feeling in the world is to build that rapport with the patients, especially the long-term patients that when I started off transporting that sometimes I still see to this day, is very rewarding to see them, get better, sometimes not, but to build that relationship with them, it actually brought me like closer, and I became more compassionate. I became more empathetic. It was something that I was not before. But working here at VCU, I became very passionate, very empathetic, and even sometimes sympathetic towards the patients and even some of the team members as well. So my best thing ever was building those relationships and rapport with those patients, and I still do it to this day. And it's very rewarding, especially when I'm walking by and a patient's getting discharged and they're like, "Hey, Cheryl, I'm going home." And I'm like, "That's amazing. Feel better. I hope I don't see you again." So it's very rewarding, and it's very great. And that's the best thing ever.
Thank you, Cheryl. I appreciate that. Thank you. Thank you. Dan?
Well, I think, as I said, we moved here from Florida, both being natives, moved into the mountains up in Galax, Virginia, which is about 4 hours from here. And we had our own business for 16 years. And my spouse got an opportunity, offered to him to move to Richmond and work for the Department of Health. And so that's his full-time job. And then as his golf, he works here in the OR on Friday and Saturday nights from 3 to 11. And so the first year we were here, I did different odd jobs. We both come from a healthcare background in Florida, but I did odd jobs. Started out at the Department of Juvenile Justice, as I thought that would be an opportunity for me to maybe touch some younger lives. Ron and I raised 2 boys together from 3 and 4 years old. And so I thought maybe there was an opportunity there. However, I learned that the Department of Juvenile Justice is a whole different creature that I was not able to manage well. So I wound up landing at VCU, and I'm very happy here. I'm very happy with the diverse culture here. And it's very noticeable working here as opposed to other facilities I worked at in Florida, how welcoming people are. And it may have something to do with time as well. The time frame. When I was in the OR in Florida, that was 22 years ago. So that may have changed some, but I just really enjoy working at VCU and being part of the Massey Cancer Center team, being able to touch lives the way that we do. And I'm happy to be here.
Thank you, Dan, so much. And for moving from Florida myself, I definitely understand that. So thank you for sharing that. Roy?
I was sitting here thinking back to now having been at VCU for 5 years. One of the first things I love is that it just feels like I can never get bored, and there's always interesting things happening. There's always diversity. But for me specifically at VCU Health, when I was younger, I wanted to be a doctor. That was the only thing I ever wanted to be. I said, I love working with kids, so either pediatrics or I was going to be ER surgeon. It was one of those options. And it wasn't until I took a education course and a mass communications course that I found out that I actually love developing people more than I did, wanting to become a doctor. But during that time, I actually became an EMT in the military. So I love medicine. I thought it was going to give me a good exposure, look good on the resume. But then as time passed on, as I mentioned before, I love working with the students that have the passion to want to get to that next level and be the new practitioners, the folks that will either do the research to help others. And so I think, healthcare is something that's always evolving, especially as we saw the significance and the importance of everyone in healthcare, as we saw for these last 2 years. And just coming from prior to this panel discussion, I was working with my students, and they gave their final presentations. And I'm just really impressed to see what students are excited about. And the fact that they were excited about diversity, social determinants of health, understanding how certain groups in certain areas receive certain care, how other groups receive different care, and how they've really zeroed in is like, I want to be part of the people that gets them to the next level where we can now have thriving groups. Everyone's thriving at the same time, and understanding the significance of inequalities and diversity and representation, and what does that really matter. And so even volunteering to just bring somebody to the next room or sitting with them. So for me, I can get all of that even with the medicine background, but then also in an educational setting, I can help prepare the future leaders in healthcare.
Thank you very much, Roy. Dr. Cosby?
Yeah, I think I said a little bit about kind of VCU has been central, but I think I've done a lot of patient care. So I work with children and adolescents currently, but I have worked with the littles from age 4 to I've been at a geriatric state psychiatric facility as well. And I think in all of those settings, I am not an individual who does well with doing one thing all day. I need to move, I need to engage with people, I need to diversify what I'm doing. So whether that's supporting staff, doing group therapy, doing training, doing teaching, I cannot sit still and do one thing all day. And so that's initially what brought me back to VCU from some of more administrative positions, is that I need the balance of patient contact, because that's where my heart lives. Like, I need that contact, but I also need to, like I said, pour into like the next generation of clinicians, because I keep, unfortunately, having experiences with trainees where I hear some of those war stories of being afraid to talk about culture and to bring that in the room. And even kind of dealing with kind of earlier career students and saying like, oh, I was afraid to ask this initially, like, what is the culture like there? Or what is it like? Like, do you all talk about race, or do you talk about financial resources? But they were afraid and hesitant to ask those questions. And so I think letting not only patients kind of disarm and talk about things, but also kind of making it a part of everyday conversation, like talking about culture, diversity, these issues shouldn't be the exception. They're the rule. We need to talk about these things and how they impact things all the time. And so I feel like I'm in an environment where that is welcomed. And so that's truly a value I have to have at work, is I have to be able to have these conversations because I'm gonna have them anyway. And so a place that welcomes and encourages that conversation is ideal for me. And so I think that's what keeps me here. It's just all the roles and the diversity of experiences, but also kind of, I mean, I'm here for patients and families, absolutely. And I am also here for staff, because this is hard work. And I'm finding that staff need as much, if not more, support sometimes than the patients and families do to keep it going.
I agree. Thank you so much for that. So I have a fun question now. So can you tell me who is the most interesting person you've ever met at VCU Health?
I'll say that in my role, I have the privilege of getting to work with a lot of different departments, because my team runs a range of different conferences and other educational activities throughout the year. And so I get to work with folks in cardiology and acute critical care, palliative care, in chaplaincy and grief support. So I could name a whole variety of individuals, but I've got a lot of favorites here at VCU. But two of the people that I've learned so much from and been really inspired by are Dr. Danielle Narica and Audrey Roberson, who is a nurse manager in the MRCU. And both of them, Danny Narica works in palliative care. Both of them just bring incredible passion to their work. They're good at their jobs. They're passionate about patient care, and they're also exceptionally interpersonal and really value the humanity of both their patients and the people that they work alongside. So they're two of my favorites.
Thank you, Allison. Cheryl, what you got?
I am still thinking.
We
like
can come back to you. We can come
Yes,
back to
because
you.
I'm trying to think of the main one. There's a lot.
Okay, Dan, what do you have?
I think, as Allison said, there are several, and that's what I had notated here. primarily a gentleman named Sam Howard, who is a forensics nurse in the ER. Or I think that's predominantly where he is in the ER anyway. That's where I first was introduced to him by my spouse, who started out working in the ER down there before he went to the OR. And of course, I would say the other one I'm really impressed by is of course my spouse, Ron, who works part-time in the OR here, and just the level of compassion that those folks, him having worked in the ER and knowing from personal experience, visiting him at work and whatnot, the level of commitment that those folks in the ER and in the OR exude, and the hard work that they do. And I think that all of those people, I would have to say, I really look up to here and really admire them.
Thank you so much, Dan. I appreciate that. Cheryl, you ready?
Yes. I actually admire a team member that just got transferred out. Her name is Mayumi. I know you and I, Joanne, had a conversation about Mayumi, and she is the most interesting person ever. She's taught me so many things. She's opened my eyes to everything, whether it's culture, diversity, just being nice, just being a human, just us as being humans. And she just taught me so much stuff. She's so interesting. She's so loving. She's so caring. And she is a transgender woman who is the most beautiful woman that you would see. She just beautiful and in and out, and love her to death. I admire her so much. Her courage, everything. It's just, she's amazing.
Thank you, Cheryl. I appreciate that. Roy?
This is a tough one because kind of like I think what everyone else has said so far, it's hard to bring it down to just one. But when I think about interesting, I like to define it as someone that can either challenge me to become better, and AKA hold me accountable, but then also where I can learn something about that story that's unique, right? And because stories are important, that's the reason why we have diversity. The first three names that came into mind was honestly Dr. Marcel Davis, Adam, not to throw you a cliche, but I would love, there's something interesting just in our small conversations that I'm like, there's more to Adam, to this conversation that I would love to get to know, just from small little snippets that you shared, and even to the one that you shared before we even got on, how you learned, you're a great dad, right? Because of this unique, cool thing. I think that's dope. And then also, Joanne, I have to throw you in there because, you're one of the first people I met that I find that a breadth of story and depth also helps affect how we move forward. And then also just being able to learn from your stories. And you may not notice, but I'm taking mental notes so that I can actually okay, that was an example that was shared. I can keep this in mind in the future. And so even those small interactions, I think all y'all are interesting for very unique reasons. So not to be a cliche, but those are my options.
Thank you, Roy. Thank you so much. It's very sweet. Very sweet. Dr. Cosby?
Yeah, okay, so I'm going to break the rules too. I don't think I have one person. I feel like I have kind of two categories. So my initial thought when you asked the question was really more about a patient that I had that was admitted on inpatient, and it happened to just be like rare admission because it was a 5-year-old, which is rare for mental health. But there were concerns of like an acute psychotic break in a 5-year-old that was just terrifying. And he had stopped speaking. And so I was his therapist on inpatient. And, we ended up kind of doing testing and all the things. And we think that it's more closely associated with autism. But we were able to get them the resources that they needed. But I think what stuck with me is that early on, he wasn't verbal and he was really scared one day, and a kid was having an escalation. And I am very trauma informed, and I don't touch patients unless there is a need. And he was terrified, and he just clutched my hand. And I feel like that was the most powerful little moment. It crossed all my intersectionality. My mom spirit came out, and I just felt like he needed that protection. I think that I hold that memory because he wasn't speaking, but he needed something, and he knew I could give it to him. And so I just remember that from like being a touching place of like he's sticking with me for the rest of my life in terms of memory. So that was one why I can't, because more patient specific. But the other I think of is more staff related. And I would have to say Dr. Cheryl Winfield, who's a psychiatrist here, and was interim medical director. I have seen her walk with such grace in the face of change and turmoil and systemic issues, but also always willing to kind of lend an ear and extend herself beyond reach for her patients and families. So I think she has kind of been a resource for me in so many ways, but also I think she was here before this building was here. So she's been with the system for years and years and years. And so it drives home for me the importance of understanding the historical context of where we've been and kind of how we got here. And so if I need that historical context, I know where to go. She's right up the hall. And she's always available to provide it. And so I think seeing her navigate that leadership role, but also just the grace that she's withstood lots of systemic challenges, because no system is perfect, but your response to how you handle those situations, I've seen her move so fluidly in times that I think others would have struggled. And so I definitely look up, and I think I would have to say that she's at the top of all the people I've encountered.
Thank you so much. And I really enjoy you sharing the story about the 5-year-old patient. Thank you so much. That was really special. So I have another fun question, and then I'll end with a more serious question, if you will. So this one, you ready, Allison? What do you believe is the closest thing to real magic?
Man, there's so many ways I could answer this question. I think that there are lots of ways that we experience almost real magic in our lives. I think, so I'll answer this more specific to what I've experienced in VCU health communities in the last couple of years. I think for me, what's been magical in my job is finding ways, even though all of our events have had to be virtual in the last couple of years, finding ways to make like a real human connection as much as possible in a virtual form. It's really hard to do, but I think is really important. And the one that stands out to me the most, there was a session we had for, there's a conference we run focused on grief every fall. It was back in October. And we have done plenty of self-care kinds of activities over the last 2 years. And I think all of you have, kind of heard that, like, practice mindfulness and do your yoga and take a break. And those things are helpful. They really are important for people to hear. But for this session focused on grief, instead of giving people a list of things to practice, we had 3 different providers from different disciplines at VCU Health share really personal stories about a time that they struggled in their role, whether it was conflict with a colleague or just feeling emotionally overwhelmed by a patient tragedy, dealing with all of the weight of COVID. And I think hearing people from our audience react to those personal stories, I think was actually the thing that people needed, just to be seen and understood, and to, that moment where you say like, oh, you too, like that is really what friendship is about, is seeing yourself in someone else and finding that human connection. So that's what I would say is a moment of almost real magic for me.
Thank you, Allison. Thank you so much. Cheryl, almost real magic.
Almost real magic is this VCU organization in general. It's like magic to me, because when you have an organization where you can literally build any relationship with anybody, everyone has the same, well, not the same values, but come together as a whole or a team. I know plenty of people who've gone through some really tough times, and I've seen a lot of team members in plenty of units come together, raise money, raise funds, raise any type of thing for to help out with family. Just how diverse everything is. Like, it's just so magical here. When you walk in and you say, hello, Michelle, hello, Roy, hello, Joanne. I reached out to Joanne and I was just like, hey, I need help. And she was like, you know what? Gotcha. Help me, called me, everything. That's magic to me, where, just building these relationships, this organization in general it's magical and it's really appreciated.
Thank you, Cheryl. And of course, I'm always willing to help you. Thank you for that. All right, Dan. Almost closest to magic.
Well, closest to magic. There have been lots of close to magic moments in my life. I was a father at 17 and again at 18. So there's been lots of streets paved by myself and my spouse of 35 years. I would say that there is a lot of magic in the air here at VCU, and I don't say that lightly. I've been in, like I said, many healthcare facilities. When we were in Florida, we were contracted by a company in San Diego. So we actually covered 27 different facilities in the Central Florida area. And we would go into each of those facilities. And just being here the 3 years that I've been here, it is such a different environment. And as I said, I don't know if I can truly say that, because the last time I was working in a healthcare facility was like 22 years ago. So I'm not sure how fair that is, but just based on my experience from then, there's just so much close to real magic happening inside this facility, I feel like. And I tell my friends, that it's not like a job, because I don't dread coming to work one single day. I'm not one of those that posts on Facebook how dreaded it is that it's Sunday night and tomorrow's Monday. And I don't dread one moment that I'm coming to work here, and just the people that I work with, and just the awesomeness that takes place here on a daily basis. I think it's just outstanding.
Thank you, Dan. Thank you so much. Roy, magic.
Tough one. Again, these are some good questions. I think, with magic, I was trying to replay, the old TV show where you had that one guy that was showing how magic was done. And it's about shock and awe and being surprised. And then you have an epiphany. Oh, wow, that's how it's done. But I would define the closest thing to real magic is a positive prognosis. And I say that because, sometimes we can operate from a position of, I'm not sure what's going to happen. But then there could be something that comes along that changes that thought and says, hold on, maybe this is what this is what I needed, but I didn't realize, as Allison shared before. But then now I can see there's light at the end of the tunnel. And I mentioned prior to coming to this discussion was that my students gave a final presentation on what they've learned. And I'll be honest, the prognosis was, I'm not sure what I'm getting, but we're going to see. And I sat there in the class just inspired by the students, because one of the coolest things is that I'm seeing them now. And it's like, after their presentations, I can see them 15 to 20 years from now doing exactly what they said that they could. And so that to me is a positive prognosis. And having been before, when I woke up this morning, I wasn't sure, but now I left with the idea that those students are going to do some really cool things. And so that to me is positive prognosis.
That is a great feeling. Thank you for sharing that. It's the future, right? The students in your classroom. Absolutely. All right. So Dr. Cosby, magic.
It's hard because I have lots of different thoughts. I think what I end up coming to is, I think the closest I can think of where that comes from, or where I think people perceive magic, comes from a place of just real self-reflection and authenticity. And I felt sometimes that people think certain interventions or certain things have magic associated with them. And the thing that I think is kind of the most helpful is just being honest and being authentic about what is happening, what I'm experiencing, what I'm bringing. The number of times I have had conversations with people about things that I have no control over, but they have left the conversation relieved just because we've owned that we don't have control over that thing. And so what is the part that we might have control over? as we speak right now, I have a mini snack bar in my office. Patients do not come to my office. This is only for staff. And I just created a let it go bucket because people are coming in getting treats and I need them to leave some of their worries in my bucket so I can throw them in the trash for them. And so I feel like that's a little bit of magic for them because people were doing it anyway. And so I think when I think of that, it isn't anything magical, really. It's just giving people space and not judging and letting them say and feel and do and take a piece of chocolate on their way out the door if that gets them through their day. I can tell how people's days are going by the time I leave my door open. By the time the end of the day comes and my tray is empty, I know that there's been a thick air in the building that day. And so I feel like that, just kind of having a space for people to feel okay saying whatever they need to say and just letting it go, because we all have ups and downs and bumps in the road, and this work, again, it's hard. And so just having a place to be able to let some of that stuff off your shoulders is the closest I feel like I get to magic, and I have dropped some things in my own bucket.
I love that. Thank you. A let it go bucket. That's awesome. All right, I have one more question for everyone here. So can you share what is a change you would like to see at VCU or VCU Health or also?
Yeah, that's a big question. And first I will say, Dr. Cosby, a snack bar always sounds magical, especially if chocolate is involved. So kudos for that. Maybe that's what we need at VCU Health, more snack bars. I think, I think our organization is, everyone's experiencing this across the board. We're in a challenging place, I think, as we are evaluating where we are in the current state of COVID and all of the trauma over the last couple of years collectively as a country. And, we're certainly experiencing that in Richmond across the board, and here at VCU is thinking through, what does sustainability look like, and how do we engage folks? How do we serve our community well and also serve our staff well, so that our workforce is sustainable, our organization just as a whole is running in a way that makes the organization stronger. It's not a specific change necessarily, but I think there's some big picture evaluation that we're in the process of doing across the board of making our organization stronger and healing over from a lot of the trauma that's come up, both politically and culturally, as well as in terms of the pandemic itself, all of those things.
Thank you.
Can we go out of order?
Appreciate that. You want to go out of order?
Can we go out of order? I'm gonna switch things up just a little bit,
Okay,
just because I got the thought and I'm ready. I need to get it out.
All right, go for it.
Did you have a follow-up to what Allison just said? Because that was actually a really good point.
I was going to say that's a beautiful point.
Absolutely.
You're right. Thank you, Roy.
Sorry, not to break things up just a little bit. You know how, as Dr. Cosby said, I'm gonna show up authentically. And some of these things, I think this question gets me excited because change is about growth and innovation. And I think just having been here on this side, I think the challenge and the opportunity is what we're seeing today. And by that, I mean, is an interprofessional opportunity for us to come together and break down some of these silos to see how my work interacts with Dr. Cosby's and Dr. Cosby's interact with Cheryl. These conversations around celebrating the diversity on this campus, in the sense of diverse roles, the diverse target populations, I think that to me is the greatest thing that we can get to, because while, diversity is touted at any place, right? Any organization, the opportunity is how do we then celebrate each person's role in their sphere of influence, but then how can we create an opportunity where I glean from you and you can glean from me, and we start interacting on one accord. And so it's not change in a negative sense, but if we can get to that real one VCU where I know someone, 3 down the way, that to me, I think would be the strongest point, as Allison also shared. So sorry to go out of order, but I had to. Sorry, not sorry.
Sorry, not sorry. I appreciate that. True teamwork, true collaboration. That reminds me, Roy, of when you have star athletes, right, that come together for a district meet or for an all-star tournament, right? So thank you for that. Thank you. Cheryl?
I don't know how I'm supposed to go after that. Allison and Roy, thank you so much. What they said, but also I think a change that is needed is more so appreciation and a morale booster. I really think that this organization, I'm sure Dr. Cosby, like the doctors, they're worn out, they're tired, throughout the pandemic, the student side, everyone is burnt out, tired. I really think a change is to appreciate the team members, appreciate the doctors and nurses, appreciate the ones that are still here and working and grinding through everything, that are still taking care of their patients, taking care of their families, trying to take care of themselves, mental health. A change is boost the morale, help these team members with mental health. Mental health is not out there, it's not talked about. It's shut inside until the last minute. And a change is, I really feel like that's something that needs to bring more forward, especially with doctors and nurses and the people that are in the front line and just, going through it. And I really feel like a change is needed in that.
Thank you so much, Cheryl. Thank you so much. Snaps. Dan?
I think all of those are really good examples. I want to backtrack 1 second because I had documented a real simple answer to the question, what do you believe is the closest thing to real magic? And that's just one simple line. And I think it really resonates with me. And that is being seen and loved for who we truly are. I think that is truly magical to me, for people to see us and love us unconditionally and for who we truly are. Now, as far as the other thing, I think we had touched on this topic one time in one of our Zoom calls. I think one of the changes I would like to see here is the safe person roles that we talked about, or safe person, some IDs, somehow to identify yourself as a safe person, especially with all of the things going on now with the school board's meeting about the trans learning and everything in schools and things like that. I'm seeing more and more people, teenagers on TikTok who are looking for a safe person. And I outed myself on TikTok and Facebook last week as a safe person. And I think I had 12 bites and got into private conversations with 12 different people who were actually looking for just that, a safe person, somebody safe to come out to, that they either hadn't come out to their family or they want to come out to their family, but they were looking for advice. So I think that's something really important I know we've touched on it before, but I think it's really important for us to kind of explore that more and lean towards figuring out how we can do that, how we can be walking down the hall and somebody look at us and know that we are a safe person if they need to come out to us, talk to us about certain things. I think it's really important if we kind of lean toward that kind of change.
I agree, Dan. Knowing who our allies are that we know can support the LGBTQ community can really save someone's life. So thank you for sharing that. There's safe zone programs at several different healthcare systems, and I think it would be a wonderful initiative right here at VCU Health. I know VCU has a safe zone program, so doing that here in the health system would be wonderful. Dr. Cosby?
I mean, it's hard to follow at the end of all that. And so I agree and piggyback on a lot of what was said. I do think systemically, I think more conversations about this. But on the other side, I also say more hours in the day, which we can't actually get. And so I think part of this is kind of understanding that the health system is a business and that we provide a service and that is a part of it. But I think for me as a provider, balancing kind of clinically what I'm doing, teaching wise, what am I doing, and trying to boost morale and how that takes time. And so like being able to prioritize what's important and how time is delineated, while also trying not to burn out myself. And so I do think more space. The fact that, Cheryl, you mentioned kind of having space for mental health issues. And I'm thinking in my mind of the multiple programs that are in existence, but that people don't have time to go. Like I don't have time to take an hour to reflect on my own stuff. That's selfish. I need to go and do something clinically related. And so I think making that more of a culture where it's expected that we take care of ourselves and not, I hope you have time to take care of yourself. Granted, I don't think any of those messages are intentional. I just think this is heavy work and there's a shortage of people to do it. And so there is a push to do more with less resources. And so I would love more hours in the day. I don't want to work more hours in the day, but if we could add some time or give me some clones or something, that'd be great. But otherwise, I think just making like prioritizing the things that aren't on the business side of healthcare so that we have time to collaborate and work with other people and individuals. And it's not just me borrowing time from something else that I have to then put on the back end of my list of things to do tonight. So I think just kind of weighing kind of what that looks like in terms of time distribution and making sure there's room for all of it, because everybody has unique and important things to add, and making sure people have space to do it.
Thank you. Those are all beautiful points. And I think it's really important that we have been able to record this and have an opportunity for it to be viewed. So many people at VCU Health System are going to be able to see this and are going to be able to hopefully implement some of these suggestions for change. I want to offer a very special thank you for everyone for coming here today and sharing such an important part from yourselves, what you do for a living, your lives, your families. Thank you so much for just being here and being open and bringing your authentic selves. It's very special. The true meaning of what it looks like to celebrate diversity. So thank you all very much. Before we leave, I do want to let everyone know who's viewing that this month, Roach and I, next Wednesday on the 27th at noon, will be hosting Dire Conversations, and we invite everyone to attend that. You can see that link on VCU Intranet, Health Intranet, and we really hope, again, that people turn out and have, real talk, difficult dialogue, fun dialogue. And then also this month, I'm going to be featuring Angie Couch. She works in the emergency department doing patient discharge. And we're going to be talking about perseverance and what that looks like in diverse communities, particularly her own experience with perseverance. So again, thank you all very much. And I, again, can't thank our panelists enough for sharing with us today. I hope everyone has a good afternoon. Enjoy your Wednesday.
Thank you.
Thanks, Joanne.
Thanks, everybody.